Hi, my name's Debbie. I'm the Serious Mental Illness Annual Health Check Champion. This is a short webinar. The purpose is to provide an overview of how to encourage patients to attend their SMI Annual Health Check and improve understanding of barriers, where to access support as well if that is needed. So those with the serious mental illness such as schizophrenia, bipolar disorder, psychosis, unfortunately experience the greatest health inequalities. Life expectancy is 15 to 20 years shorter than the average population, and the majority die from preventable illnesses like cardiovascular disease and smoking-related illnesses. As you perhaps know, every year those on the SMI register are offered a health check, and this is really a good opportunity to discuss physical health goals such as movement and fitness, to offer ongoing support through, for example, social prescribing, for early intervention and prevention of the development of long-term conditions. And it's also an opportunity to just check in with them if they've got any other needs. It's a kind of a holistic assessment, even though it's really focusing on the physical elements. We also really want to focus on, is there anything additional that that person needs support with, so that we can direct them to the appropriate places and to signpost them. So here we have a definition. What is SMI? What is serious mental illness? SMI refers to any mental illness that is debilitating enough to have a significant long-term impact on the person's ability to engage in functional or occupational activities. So if you're involved in the SMI Annual Health Check, you'll know that it covers the 6 core processes. But what we do is we aim to complete an enhanced health check to include a conversation on nutrition and diet, physical activity, and the assessment of illicit substances and a medication review. Obviously, screening and referrals are guided by the Leicester tool. The link is here on the side of the slide, and also a completion of a health action plan, which addresses the biological, psychological and social factors that a person might be facing. As I've already mentioned, referrals to social prescribers is one of those situations where you're doing an onward referral, and third sector organisations, there might be people like Staying Well who actually visit people in their own homes. They might support people to access services, but they also might help them to attend appointments as well and give information and advice on health-related subjects. So they are a really good contact to have. Here are some communication top tips. Building a rapport and a relationship with the person is always great for that person's confidence. It will hopefully encourage them to come back every year for their appointments. Just taking that time to show that genuine interest, listening actively by focusing on what matters most to that patient. If you are delivering information that might be medical or might be perceived to be complicated, breaking it down into explanations into smaller, more manageable steps. That person may have cognitive difficulties. Sometimes the side effects from medication can impact on that person's ability to understand things. And setting clear expectations. Explaining what will happen at the appointment to reduce anxiety. So if, for example, it could be if you're working on reception or in a more clinical role, that person, they might have some anxieties about the appointment. Sometimes we do get people who have got needle phobias, for example. So it's just explaining the procedures, making sure that they've got an opportunity to settle themselves and relax a little bit before they start the appointment, Sometimes it can be a good idea if they do need some small changes, like waiting in a quiet area before they come for the appointment. That can hopefully help to alleviate any anxious feelings. Checking understanding, confirming that the patient has understood the information that is shared. Sometimes it's about relaying things back to that person, just making sure that they understand what has been said, and which we'll come to later on in the presentation. Sometimes it's good to have a carer with them, just so that they can be there as a support, and then they might be able to help that person to digest that information after the appointment as well. Always ensuring a warm welcome, thinking about the invitation process and reflecting what has been successful in the past for that person. Ideally, tailoring the invitation process to that individual. Some people prefer text, some people prefer emails, letters. We do tend to advocate that the patient packs are posted out, because they were co-produced with patients, and the feedback that we got was that they were kind of preferring a leaflet in advance of the appointment that was easy to read, user-friendly. The envelopes even have got a picture on the front, which are quite nice and bright. The feedback was that they didn't like the brown envelopes. So these packs really do encourage people to come for their appointments, followed up by phone calls in some cases, and most definitely sending out text reminders ahead of the appointment. I know that it's quite common when people don't attend that it's classed as a DNA. What we're trying to do is to change that a little bit by considering that that person could not attend on that day, and looking at what are the barriers. Was it the appointment time? Was it something to do with the invitation process? How can we make it more appealing for that person and encourage them to come along? As I've said earlier, bringing a friend or a carer if they want to do so. Do they need any small changes making, or what we class as reasonable adjustments? And actually informing the patient that they can ask for these changes. Sometimes they don't know that they can ask for reasonable adjustments. And what we're trying to do is to make that appointment more accessible, so that we can help them. You might want to reflect on examples that you've got yourself when you've engaged people who you've always considered them to be kind of hard to reach. Have you involved anybody else? Have you had to look at other services? Do they already engage in the surgery with somebody else, like a social prescriber or an occupational therapist or a pharmacist even? So it's just really thinking outside the box, I suppose. It's sometimes just thinking of how we can draw that person in, what's best for them, how we can encourage them to keep coming back. There are times when people with a serious mental illness may not be feeling at their best before an appointment. So it's looking at the patient experience. Sometimes they might fear that they're going to be judged, that there's a stigma attached to them having a mental health condition. It could be that they are anxious about the appointment or the procedures. It could be that there's a sense of embarrassment or shame. They might have difficulty processing information. So there's a lot of things to consider, and they might not always express that. It could well be that they sometimes avoid medical appointments completely, or engaging with any services, due to how they are currently feeling, and if they're not feeling well or feeling quite depressed, then that's certainly going to impact on their ability to engage. Or it could be that they've had some past negative experiences or traumas that are preventing them from coming forward. I think it's important as well to think about how you might be feeling. You might be feeling uncertain in some ways, or you might have a real desire to build trust and a meaningful relationship with that person. But it's just being aware, I suppose, of how that person might be feeling, how you might be feeling, and what can we do to bridge that gap. If the patient is in a bit of a cycle of avoidance, it can be difficult for them to attend. So there are lots of different ways that can be tackled, I suppose. It's finding out what is the reason for the avoidance, reassuring them if they need that reassurance, that they will be valued and heard, making those adjustments, making the appointments a bit more flexible, and having that clear communication, creating that safe, non-judgmental space. Mental Health Together produced a report, Physical Health and Severe Mental Illness Report. And what they found was that the top 3 barriers to patients attending their SMI Annual Health Checks was, the first thing was the lack of confidence and self-esteem. Many individuals with serious mental illness may doubt their ability to engage with healthcare services. They sometimes have that fear of being misunderstood or judged, and that can lead to that withdrawal. Building that trust and reassurance is the key to overcoming this barrier. Lacking motivation, if that person is not feeling too motivated, then that can prevent them from attending appointments. The side effects from medication can mean that they feel drowsy or tired in the morning. So again, adjustments can be made there to ensure that that person is invited for afternoon appointments. So just to summarise, we want to support people to attend. We've talked about some of the ways that we can overcome barriers and how that person might be feeling. We've talked about involving carers, which is really important. Carers often have a deep insight into the patient's needs and routines, and their involvement can improve that communication, reduce the anxiety, and support with any follow-through information or onward referrals. They might need additional support options by referrals to social prescribing team to help them to access community resources to reduce that isolation and build up the confidence in all aspects of the life. And the Staying Well team and other services can support people to attend appointments, engage with their healthcare, and the key message is collaboration with trusted individuals and services can make a significant difference in overcoming those barriers to attendance. And any further support from me, please just get in touch with me. My contact details I'll be bringing up on the next slide or the next couple of slides. I'm putting together some recorded webinars on different subjects relating to the SMI Annual Health Check. I can provide resources and help with signposting if you need any further information about invitation process or reasonable adjustments. So you're very, very welcome to get in touch with me if you would like more information. I can also attend your practice in person if that's what you prefer and work with either admin or clinical staff. So other support and information you might be able to get from your advanced clinical practitioner for mental health within your PCN. They should be able to give you all the necessary advice that you might need relating to the annual health check. or any support that you might need with a patient. So what can you take away from the session? Thank you very much for listening, and I hope you've enjoyed it. If you do need to contact me further, here are my contact details.